Good. All right, hey everyone, I'm Brittany Clemens with WMBD. Right now, I am at the Carver Fawcett Center or Field where they're doing COVID-19 testing. I'm going to wait for a few people to get on before I start. Right now, I have Michelle Sanders, who is going to answer a few questions related to COVID-19 testing. We know there are a lot of questions regarding the testing, so hopefully today she will be able to answer some of those questions. Brian will let me know when we are all set to start asking the questions, when we get a few more people on. Make sure you guys can hear me and everything through the mask. Okay, so I'm going to pass this to you. You can clip it on and step back.
Thank you. Okay, I think we're all set.
So for those who are joining, can you just again state your first and last name and your title?
Sure. My name is Michelle Sanders. I am the Director of Marketing and Development and also Communications, and I oversee outreach and enrollment for Heartland Health Services.
All right, so the first question that we get a lot, who all can get tested and are there any restrictions?
Okay, right now the restrictions have been lifted as they were first when we started the testing sites. We can see anyone who has a COVID symptom. And saying that, I mean fever, headache, body aches, anything that would relate to having like flu-like symptoms. And then we also are looking for those that are over the age of 60 that might have chronic illness, or anyone who has diabetes, hypertension, obesity, any of those kind of symptoms. Now, if you're a frontline worker, we definitely want to have you come in. Those would be our nurses, our bus drivers, anyone who works in a factory that's close together and doesn't have that 6 feet apart. So we want those people to come in. Or if you just think you've been in contact with somebody, then you need to come in and get tested.
And why are you guys asking for insurance if testing is free?
Okay, the actual test is free to have you come through. There is no copay, but the lab that is processing the collection, the specimen, has to charge that to the insurance company, and we're not doing it. The lab is doing it, so there is no cost to the actual person. They just have to do that for the state to reimburse them.
Okay, and we also just got a question in from Facebook Live. Can any age get tested?
Okay, anyone under the age of 18, we are not testing unless you have a doctor's excuse for like a teenager, because children that are under pediatric care, we can't test. That swab, neopharyngeal, is not a good test for children or pediatric care. But if you are the age of, let's say 16, maybe 17, with a parent and a note from your doctor, then we can test you. And that has to be cleared through the nurses station when they come through.
And if somebody doesn't have insurance, are you still testing them?
Yes, if you don't have insurance, please still come. We will give you information on how to get insured. We have navigators on site that can contact you at a later date to get you insured, but don't let that stop you. What we're trying to do is control the COVID, and so by doing that, we don't want that to stop you from coming through. Mm-hmm.
And can they still get tested without a photo ID?
Okay, no. You have to have some sort of photo ID so that we can identify you, or at least have your driver's license. And we do that because when your specimen is turned in to the collection site or to the lab, they have to verify your date of birth, your ID, and your social security. So that way we can confirm that person is you that is getting tested. So no, you have to have all that information.
And what happens after you reach 150 tests? What is the limit of testing per day?
Okay, we are set for 150 per day unless the state advises us that we're going to have more testing more testing kits come in. Right now, it's 150 per site that we're doing. So, once we do that, first come, first serve, we're done. Mm-hmm.
And at what point do you turn people away from testing?
Okay. We won't turn you away unless you are not symptomatic, or you're not the age of 60, or you're not a frontline worker. You have to have some sort of symptom. Otherwise, we're not going to turn you away. We want everyone to come and get tested.
And can you get retested if you come up already?
Okay, if you come up negative and you've been tested by us, you need to have your doctor consult with your PCP, your primary care physician, and see if you really need to be tested. Because granted, the test only lasts a week, and you might come up with the symptoms. But if that's the case, talk with your primary care physician first, and then come back to be retested if they say so.
How many people have you turned away so far since testing began in Peoria County?
Actually, probably no more than 10 people, because some people came because they just wanted to be tested, and they found out they didn't have any symptoms that were what we were looking for, and they just said thank you, and they left. So yeah, we've had about 10 people probably.
How many people have been tested since testing began in Peoria County?
I believe we're over probably 700 now, because we did 297 the first 2 days that we did it, and we've been consistently doing roughly 150, except for on the weekends with the rain. That kind of slowed things down, but I believe we're probably close to about 750.
Do you have to live in Peoria County to get tested?
No, we've been testing people from the McLean County. They've been coming from Tazewell, Woodford, as far as a little bit still Peoria County, Chillicothe way coming this way.
And how will people receive their results?
Okay, results are now being, you have the option. You can either receive it by text, or you can have someone personally call you and let you know what your test results are. The text just started, so for those that maybe had gotten tested earlier, we did not have the text in place, but now moving forward, you will receive a text if you so choose so.
And can you explain the testing process to people who are kind of nervous about coming up here and getting tested?
Sure. Okay, so when you come through and you get registered with the team out there, you go into the first station. Station 1 is where they will give you a tissue, tell you to blow your nose, to clear out your nose, and give you the instructions on calling in for the results and what to expect after the test. Then when you get to the nurses station, that's when it gets kind of tricky. If you're kind of sensitive of your nose, it might be a little uncomfortable, but they take the swab, and it's the neopharyngel, if I'm saying that correctly, and it goes all the way up. So it is kind of uncomfortable, but it only takes about 10 seconds. 10 seconds, and then they take the swab out and then bag it up to be sent to the lab. So it maybe have a little bit of discomfort, but it's not that hard. We haven't had too many complaints from a lot of people, and some people are sensitive to with their nose. So,
and are there any other methods of testing, or is it just the nasal swab?
No, it's just the nasal right now. That's what the state sent us, and that's what we're working with.
Are walk-ins available for those who don't have a car, other means of transportation?
Yes, especially down here in this area where we're at right now. We've been getting a lot of walk-in traffic. Walk-ins, all you have to do is come in. They'll do the same process. You have to have 2 forms of ID, and they will register you in, same process, and walk you over to the tent, and then they will process you from there.
And how accurate is the nose swab? Have you seen any false negatives yet?
Right now, we're unsure. We haven't had any come back, so we're waiting to see if the lab comes up with any. They have not notified us of any false negatives, so that's probably a plus right now.
Where will the next testing site be this week or this weekend?
Okay, so the next, we are closing down the one on Wisconsin on Saturdays. That's our East Bluff location, because we already have the Peoria Health Department running. So we're going to be testing on Saturday and Sunday there, and then we're going to continue to test here at the Carver Fawcett Field Monday through Friday, 9 to 4. East Bluff, 9 to 4, which is our Wisconsin location, and then the health department will still be there from 10 to 2, Saturday and Sunday.
And how can someone follow these testing sites updates? Where can they go to find where the sites will be?
You can go to the health department's website. They have them posted there, and I will be updating our Facebook and our website today with the testing sites. So they'll see all the information there.
And how long does it take to receive the results?
48 hours. That's we had a little rough start, so anyone who got tested and did not hear, I had gotten a few phone calls. If you did not hear, that's because you might have got shuffled around a little bit, but it takes 48 hours for someone to contact you. And now with the texting in place, you should get an answer faster. So 48 hours is what we are telling everybody to expect the results.
Could you explain insurance again? We've had quite a few people asking, if you do not have insurance, do you still get tested? And how does it work if you have insurance, if you don't have insurance?
Okay, if you have insurance, what we're doing is that the lab is actually sending the billing to your insurance, and the insurance is getting reimbursed with the state. So the state is taking care of that. You won't have a copay or anything. If you're not insured, you still come and we'll write on there that you're uninsured, but we will give you information about getting insured, and we'll have one of our navigators with Heartland Health Services follow up with you to see how we can assist by getting you enrolled in Medicaid or Medicare or Marketplace. So,
will it cost them anything if they are not insured?
No, it will not cost them anything if they're not insured. We know some people are uninsured, and we've spoken with them. And we're here to assist to make sure you get tested for the COVID, and then also to make sure that you're insured properly as well. So we're here to take care of that.
All right. And do you know of any other questions that I probably didn't ask you that are frequently asked when people drive through, or maybe through phone calls that you should probably answer right now?
Well, we want people to use the COVID hotline, which is, I hope I'm saying this correctly, 309-495-8659. To call if you have any questions. You can also go on our website at www.hhsil.com, and there's a section on there where you can send in requests for anyone to ask a question, or if you have any questions about COVID. And then always keep checking the Facebook page for the health department and for Heartland Health Services.
And a question that we just got right now.
Yeah.
Can frontliners get tested without symptoms?
We want frontliners to come in, yes, because they've been around other people. So if you worked on the front line, yes, that's an automatic. We write on the testing, on the lab requisition that you are a frontline worker and might have been exposed. So yes, we do want the frontline people to come in to the testing sites.
No, your birthday.
Awesome.
So guys, we will have this up on our website on ciproud.com later on today. If you missed a portion of this Facebook Live and have some questions, you can head over to ciproud.com a little bit later today, and we will have this video along with the written portion of the frequently asked questions.